Yeah, Rodolfo, thanks for the opportunity. My name is Matt Abdel, and I'm a hip and knee surgeon at the Mayo Clinic in Rochester, Minnesota. Yeah, I've been fortunate, Rodolfo. I've had several mentors, and I kind of bucket them into surgical mentors, clinical mentors, research mentors, and now administrative leadership, volunteer mentors, really now colleagues and friends. And surgically, I had several mentors, but Dr. Arlen Hansen, Dr. Dan Barry have been some of my most pivotal mentors. And from a research perspective, actually, Dr. Bernie Morey has been one of my most pivotal research mentors when I was a resident and young on staff. And so I've had been fortunate to have several mentors, both in kind of the clinical research, clinical practice, surgical practice, but also in the basic science laboratory shield as well. Yeah, as a hip and knee surgeon, what I've really tried to do is align my lab and my lab's interests with my clinical practice. And so then there's this nice symbiosis between what I'm seeing clinically, what I'm studying in the lab, what I'm finding in the lab, and how I can translate that back into my practice. So most of my work revolves around hip and knee arthroplasty or joint replacement. And in specific, I'm interested in whole exome sequencing. I'm interested in RNA-seq and what's happening at the tissues locally. And specifically, the pathologic process that most intrigues me is arthrofibrosis or stiffness of knee replacements. And the, excuse me, cellular and molecular mechanisms that contribute to that, the predispositions, epigenetic or genetically, that might predispose an individual to that, and the non-mechanical, non-surgical factors, but actually the soft tissue milieu and envelope around the knee that contributes to that debilitating arthrofibrosis. There's a lot I appreciate about the ORS. Probably most is it gave me an opportunity as a very young investigator. And I mean a young investigator, I mean as a second year resident. And so I was given some seed funding to start the research that I'm continuing to do right now. I met many individuals, peers, but also mentors who opened up many doors for me and encouraged me to move this line of research forward. And I'll just give one simple example is the CSDP program, which was pivotal to me because I heard from several surgeon scientists how to balance a surgical practice and a research practice in a symbiotic fashion. So for me, it was very formative, particularly early in my career. And now, of course, I enjoy the interactions with peers from different specialties, different institutions, different regions of the world, and different aspects of techniques, but also lines of investigation. Yeah, I mean, you could slice it in a variety of ways. I mean, we all have challenges. For me, the biggest challenge is balancing my practice with my research. And that's why that symbiotic relationship between the two, between what I'm doing in the practice, what I'm doing in my lab is key because that interface is present. And so it's a time management. It's a balance of that. So that's number one. Number two, grant funding. Everybody is involved in grant funding and has had those moments in which grants are not renewed, grants are not accepted, and it's that kind of perseverance and grit to continue to move forward in that line of investigation, even when one door closes, looking for the second and third doors to open that up. So I would say those are a couple of the bigger challenges I've faced and continue to face, to be quite frank with you. Be curious. Be curious. Do things that weren't done before. This was a de novo line of investigation, a de novo research lab we created at the Mayo Clinic. And it started as second year residents where we had no resources really or right to be thinking about a new line of investigation, new line of research. Now I've taken it to a formidable and large multidisciplinary lab right now. So be curious and be resilient and have that grit to push it forward if you believe in it, as you mentioned earlier. That's number one. Number two, be open to collaborations. Be open to collaborations with other divisions and departments within your institution, excuse me, but also with other institutions. And finally, do something you enjoy. If you don't love it, it's going to be hard to do it. So make sure that what you're investigating, what you're researching, what you're doing, you're passionate about, because that will give you that drive to do it at the highest level. Yeah, this might seem cliche, but my hobbies are really spending time with my family. So between the practice, surgery, the lab, clinical research, it's spending some time with my wife and my three children. So we like to travel. We enjoy the family time together, and I'm an avid outdoorsman. So those are kind of my big hobbies.